of insulin resistance. So this is a graph. I was told not to use too many graphs because it's too geeky, but that's what I'm here for. I'm here to walk you through it. And you don't have to memorize all the numbers, which I don't either, but all I ask you to do is understand the concept, okay? This is a study, and they said, you know, what if we take somebody that's not diabetic? What if we take people that are healthy and we infuse insulin? I wonder what they're going to be like, right? That's a really good question. So what they did was they took non-diabetic healthy men, they put something called a euglycemic clamp on one arm, where they clamp it and they infuse glucose in one arm, insulin, and they kept the blood sugar at about 100. So they kept fusing it, and they injected them with insulin very, very slowly. And what happened at the end of the study is that they found that after keeping the insulin high for a period of time, they developed insulin resistance. And these were people that were not even diabetic, they were healthy people. And they found that they were less sensitive to the insulin. What does that tell you? You can actually cause insulin resistance in someone artificially just by infusing them, okay? So then the next study, they said, you know, the previous study, they used too much insulin. You know, that screwed the data. They're not normal physiologic levels of insulin. So they said, you know what, we're going to go back and repeat this test. And this is from Diabetologia, published in 1994. And they actually used normal levels of insulin, levels of insulin that you would find in, you know, regular people, okay? And they did the same thing. And what they found was after the insulin was infused and kept at a certain rate, they found that the person's insulin sensitivity decreased. They were able to dispose of less glucose for the same amount of insulin. What about diabetics? What would happen? This study is really, really scary because they wanted to control diabetics' blood sugar because they thought that reducing their blood sugar was going to make them healthier. So they used insulin. And what happened with these diabetics is very interesting. They became even more insulin resistant. They got worse. Their diabetes actually got worse. Their sugar was great. They were really, really happy with the blood sugar. But their insulin resistance, which is right over here, their glucose disposal rate, this is how sensitive you are to insulin, and the more they gave them, the worse they got. That's a linear equation right there. And to top it all off, to add insult to injury, after about 6 months of the insulin treatment, they were eating 300 calories less than when they started every day. Initially, they were eating 2,000 calories. At the 6-month mark, they were eating 1,700 calories, 300 calories less, and yet they gained about 20 pounds. Why? What was causing them to gain weight? Insulin. The insulin treatment was causing their body to store fat. So you wonder why, when people start using insulin, they get sicker and fatter. It's not because it's their fault and they eat too much. Because these people here are eating less than they were before. And they gained 20 pounds. And they didn't gain 20 pounds of muscle either, okay? They weren't working out. They gained 20 pounds of pure fat. And they gained it all in their abdomen. It was all visceral fat. And the insulin was what was driving that. Okay, we're going to talk about visceral fat. I have a really interesting slide. Okay, so what causes diabetes? Well, you start with high insulin, hyperinsulinemia. It causes insulin resistance. And because the insulin resistance is not allowing the insulin to work properly, you end up with high blood sugar. the high blood sugar is the end result. It's not the cause. So the purpose of any treatment in managing diabetes should not be to lower the insulin. It should be to lower the insulin, right? You have to lower the insulin, and we're going to talk about how we're going to do that. Okay. So this is a slide that shows you the two phases of diabetes. For years and years and years before you become diabetic, your blood sugar is actually very normal. And at some point, your pancreas stops and your blood sugar starts to skyrocket. It's not a linear fashion. They say, oh, diabetes is a progressive disease. It starts slowly and then it just keeps advancing. No, it's not. Diabetes is not a progressive disease, because if you look at this chart here, they're fine all up until a certain point, and the body says, I can't handle it anymore, and the sugar starts to skyrocket. That's a very, very different argument than what the American, AMA and the ADA tell you, right? It's really not quite progressive in the way that they describe it. So I'm going to go a little bit faster because you can see that. So why is diabetes so important? If it's only blood sugar, all we need to do is take medication, and we have insulin to lower your blood sugar, right? Well, diabetes is important because the #1 killer in both males and females in all countries, developed and developing, is heart disease. Heart disease is what kills people, and so many people prematurely, right? And this is data that was collected from a lot of people, and this is not my data, by the way. This is data that's out there. You can go on Google and look up these slides for yourself. And I cite the sources just for that, okay? They found that 65% of all people, I think it's a little bit more, that has heart disease, they're either diabetic or they're pre-diabetic. So what was causing their heart disease? Most likely, the diabetes. The hyperinsulinemia is what was causing that. And they all agree on that, actually. And this is why I love this graph. This is one of my favorite graphs. And this graph was an eye-opener, and I had a eureka moment when I saw this graph. So down here we have the hemoglobin A1C. We're going to just call it the A1C to make it short now, okay? So FDA tells us that you are diabetic when your A1C level is at 6.5, okay? And you're pre-diabetic when you're around 6.0, right? How many people do you know, or how many friends do you know, they say, oh, you know what, my doctor says I'm pre-diabetic, so I just need to diet and exercise. I hear that all the time. I don't need to worry because I'm still early stage pre-diabetes. Okay, that's wrong, by the way, and I'm going to tell you why. This is, if you look at this graph, this is a risk of heart disease, cardiovascular disease, CVD, okay? If you look at this graph, the risk of developing heart disease is low when you're at about 5.0 to about 5.5, and right as soon as you pass 5.5, your risk of developing heart disease becomes exponential. Here, you see that steep curve here? Right there. So from here, you're at about 0.7. Here, you're at about 1.5. That's scary. And your A1C is only at about 5.5 when they tell you you're still normal, right? Pre-diabetes. So what do we know from this graph? What it's telling us is that these people were on their way to diabetes, but the heart attack got them first. And Mark, you're a perfect example, right?
Yes.
So 65% or more of people that die or have a heart attack, it's not the heart attack. They were on their way to diabetes. Their heart just gave out before the sugar went up. Does that make sense? And we'll see why. This is another slide that shows that even if you're not diabetic, if your insulin levels are high, you are more likely to die from heart disease. Even if you're not diabetic, just by having high insulin levels, you are likely to die. And your sugar is normal, by the way. I can't emphasize that enough. So what is the mechanism? Well, what is it about insulin that damages the heart? Hyperinsulinemia, or high insulin, causes heart disease and small vessel disease because insulin, you know about coronary artery disease and atherosclerosis, right? Mark, you know that? Where the blood vessels get clogged with plaque, right? It's not as simple as just cholesterol and fat clogging up the arteries. It doesn't work like that. Atherosclerosis is actually an inflammatory response to injury. And that injury is a result of hyperinsulinemia, because if you look at the inside of the blood vessels, they are lined with insulin receptors. And if you have lots and lots of insulin receptors on the inside of the blood vessel, and if you have lots and lots of insulin, it's going to cause a lot of damage there. And you end up with your immune system coming in and trying to fix the damage, and they're called foam cells. Okay, and that is atherosclerosis. And this is especially so in small vessels. Small vessels are very, very intricately lined with insulin receptors, and that's why the complications of diabetes affect small vessels, like kidneys and eyes. It affects every organ in the body, from head to toe, and in different people, it affects different tissues. Now that's a very interesting question. So if diabetes is one disease, why do some people lose their vision? Why do some people get gangrene? Why do some people get kidney failure? Why do some people get stroke? Why do they present differently? And nobody actually asks that question. I always wondered. And it was a question that was answered for me just recently. I always wondered, why is it that we have one disease, but everybody presents with different complications? And my patients used to ask me that all the time, and I had to tell them, you know what, I have no idea. I can, maybe guess, but it's probably going to be wrong. Well, this is a slide that's going to answer your question, and this is where your genetics comes in. Right? Everybody says, oh, it's either genetics or lifestyle, genetics or lifestyle. Well, what do we exactly mean when we say genetics? What do they actually mean when they say that? And so, this is a very complicated slide, but I'm gonna make it very, very simple for you, okay? So, the Joslin group in Harvard, what they did was, they created mice, and they removed the insulin receptors in specific tissues. So they basically created insulin resistance in only the eyes, only the liver, only the kidney cells, to see how they would respond. And what is very interesting is that if you remove the insulin receptors in the liver and the brain of the mouse, okay, they developed obesity and metabolic syndrome. They developed diabetes and their blood sugar shot up. Okay, well that makes sense, right? What they were very, very surprised to find was that, this one's really interesting. They took, the glomerular sites are tissues in the kidneys. They knocked out the insulin receptors in the kidneys of these mice and pretty much made those kidney cells insulin resistant. And they had diabetic nephropathy just like a diabetic patient. But here is the important part. Their blood sugar was completely normal. These mice, and they actually were able to repeat these studies. These mice had completely normal blood sugar, and yet they had diabetic kidney damage. How is that possible, right? So what the conclusion of the studies were, they found that not every cell in your body becomes insulin resistant at the same time. Different tissues will develop their resistance in different stages. And that's where your genetics plays a role. Every one of you has a very different genetic profile. And your insulin receptors in eyes or liver or kidney or blood vessels work better than the other tissues. And when your insulin is high for a long period of time, those tissues that have the most defect will be damaged first. And that is why in diabetes you end up with so many different complications. And when I discovered this, it was a real eureka moment for me, because I was finally able to understand a question that wasn't answered. And I'm not going to take the credit for this. This is the work of some really brilliant doctors out in Joslin, and they're still continuing to do that. So the moral of the story is you can have diabetes without having high blood sugar. That's the moral of the story right here, okay? So this is an infographic that really illustrates our misunderstanding of what diabetes is. Hyperglycemia, which is high blood sugar, that is just the tip of the iceberg. That is just a symptom. But we have all of these things. And this is all technical, real simple for you. This is, liver problems, kidney problems, migraines, endocrine problems, nervousness, anxiety, sleep disorders, okay? These are all symptoms that hyperinsulinemia causes. All right, number 2. Line number 2 is that tight glucose control is best. This is a very, very important slide that I want to share with you. And drug companies to really, really focus on lowering the blood sugar in their diabetic patients. So they did a study called the Accord trial, which was published in 2008. They took over 10,000 patients, and they used a lot of medication to keep their blood sugar low. Okay, I'm not going to go through all of that, but I'm just going to give you the Cliff's Notes, okay? They used a lot of medication to keep the blood sugars low. And what they found was the patients had really, really good blood sugar, but their mortality rate increased by 35%. That's scary. Okay, let me put things into perspective for you. Okay, you take 10,000 people, and for 5 years, your goal is to lower their blood sugar. They call it tight glucose control. Your study is 5 years. The IRB, which regulates studies, they came and shut them down after 37 months because people were dropping dead in the ER of heart disease, of heart attacks. They were dropping dead in the ER from heart attacks. And this is 35% mortality. This was not counting the people that had heart attacks and lived. So you do the math, right? And when this famous, or it's actually infamous, the doctors did not have an explanation. They couldn't tell us why they died. They had excellent blood sugars. They couldn't tell us why. And what they found was that these people, because of the insulin injections and drugs that stimulated insulin production, they had unbelievably high levels of insulin in their blood. And that was the conclusion. It wasn't the blood sugar that killed them. It was the insulin that killed them. And we know why, because the insulin damages the blood vessels, right? You see that red slide? It's our here. So what do we know? That's a line number 2. Glucose control is not the best way to treat diabetes. Because if you go chasing to lower blood sugar, you're going to end up killing the patient. But they have good blood sugar, right? So this is a very interesting slide here. So they compare drugs, three different types of drugs. Okay, you have insulin over here. This is a drug called sulfonylureas and metformin. Okay, metformin is a drug that does not increase insulin, and it's a first-line drug. Everybody knows what metformin is, right? Yeah. Compared to metformin, if you use sulfonylurea, you have higher mortality rate, And sulfonylureas, compared to insulin, insulin has a much higher mortality rate. So what you see is there's a clear trend with drugs that increase insulin, you have higher chance of dying. So what is the moral of the story here is any treatment that increases insulin in the body, it's going to kill you, either quickly or a little bit slower, right? So that's what we learned from that. That's a very, very simple graph. It can't get any simpler than this. And I really like this one because it's only got 3 bars. It's easy to remember, right? But the problem is most doctors, when a person is diabetic, before they used to prescribe just metformin. You know what they do now? They give them cocktails. So they say, studies have shown that if you combine the drugs, patients have better outcome, which is not true. And so before they used to just give you metformin. Now they give you metformin and Januvia, or metformin and glitazones. Or they give you a 3 combo, right? I have patients that come with 3 combos, okay? And what you're doing is you're pretty much using drugs that increase insulin and increasing oh, you have one right there, right? Yeah? Januvia? Congratulations! Yeah. So the important lesson here is we're not saying that drugs are bad, but if you're using drugs that raise your insulin levels just to control your blood sugar, you're fighting a losing battle, okay? That's the takeaway message. So this is one of my heroes. Okay, I'm going to try to go really fast because we have a lot more and we're going to cover a lot of information here. This is one of my heroes. His name is Dr. Joseph Kraft. And he is the father of something called the insulin assay. He was the first doctor more than 30 years ago that said, hey, don't just look at the blood sugar, look how much that will predict whether the person will develop diabetes or not. They thought he was crazy. What he did was, over the course of about 30 years, he was a very meticulous scientist. He did oral glucose tolerance tests in over 10,000 people. And he went back and looked at the data, and then he looked at the people that eventually developed diabetes later in life, and he went back and looked at which pattern they fall under. And what he found was people down here in the blue, they never developed diabetes. Same test, but people that showed a pattern of 1, 2, 3, and especially 4, they developed diabetes. It was just a matter of when. And these 3 patterns here, he calls it hyperinsulinemia. He found that even if your blood sugar is normal, if your insulin levels are high, you are already diabetic. And that's what he called it. Pattern 2, 3, and 4. And you know what percentage of the population? This is the next one is kind of scary. What percentage of the population that he studied in the over 10,000 cases were pattern 2, 3, and 4? Don't be scared. Fully 8,138 people out of the 10,829 people with a normal glucose tolerance test had a pattern 2, 3, and 4. So if you do the math, about 93% of the people had that pattern and later on developed diabetes. That's pretty scary. That's a pretty staggering. What he did was he made a copy of his book and his data, and he sent them to all the top diabetologists in the world, and they threw it in the trash bin. They didn't really want to hear him. And so there's a small group of doctors that's circulating his book. I have one. If you want one, I'll give you a copy of it. And we're trying to promote the work of Dr. Kraft. He's really a wonderful, wonderful physician. And he was able to go back and save the data. I'm a huge fan of data because without data you have nothing. You just have words, right? So this is how your body normally likes to secrete insulin. After you eat, go up a little bit and come back down. And that's actually really high, by the way. And after you eat, come back and come back down. Come back and come back down. And this right here is when you're sleeping. We call that fasting, right? So your body likes little